Hello, everybody. Welcome to the Honest Providers Podcast. My name is Dalton Young with Honest Care Systems, and today I'm with my friend Veronica Latchman, who is an LCSW with Everything Social Work. And really quick, Veronica, appreciate you jumping on and tell me a little bit about who you are and what inspired you to get into this field.
Thank you for having me. My name is Veronica Latchman, and I'm officially a LCSW as of last year, January. It was a long journey. It took me 9 tries before I passed the exam. And I guess because of that, I created Everything Social Work, trying to find out where my passion laid, because people as social workers gravitate to private practice, schools, community-based organizations, hospitals, and I felt like that wasn't something I wanted to do, and I didn't want to feel pressured going into a type of population and not do its service. I realized I had a lot of things on my mind I wanted to do, but the test was in forefront and it was a hindrance for me to move over. Like, I can't think of all these great things I want to do, and this test is like right there in the forefront. As I finally passed it, Everything Social Work came to be. I started to be like, you know what? I don't need to be that person providing therapy, services, referrals to clients in the community. I need to provide that service to social workers like me, those who struggle, those who sit quietly and feel like they're the only one out there. Like I did. I felt like the unicorn. I felt like I was the only one. I was super embarrassed when people would tell me, "Oh my God, did you pass yet?" And I'm like, "No, I didn't." And be like, "Oh, don't worry. You know, if you take it 2 or 3 times, it's not bad." I'm like, I'm on the 7th. So I had to own it. And once I owned it, it was my badge of honor. So when I tell people I've passed it, it only took me 9 times. The faces that I get is like, oh God, you know.
Right.
But I think it's a badge of honor. And I think for me to pay forward and to pay homage to my field, to social work, I need to turn around and help people who are struggling silently, who are not as vocal as me, who are not test takers, who struggle because this is the defining moment in their career that they need this exam. Right. So they can build their practices, continue their jobs. I had some people come and say, "Hey, if I don't pass this test, I'm going to lose my job. I've been there 20 plus years. I have clients." And I felt like this was the best place for me because I lived it. Right. It was there. It was in the forefront, and realizing that the typical study habits is not for everybody. I spend 95% of my time on Zooms, Teams, and everything. So me trying to study like this was not conducive to any type of learning. I check out. So I can't be with 1,000 people. I'm so nosy, distracted with all the squares. I'm like wondering like what's behind you. Is that a real cat? Reading the title of the book, and the information in the forefront is like, woo! So noticing that I needed to be in a smaller group, more intimate. I needed to be personalized to me, because granted, the information is for all of us, but the way I internalize it, the way I take it in might be different. So I needed someone to do that for me. And learning that when I found people who were just like me gravitating, it's like, "Oh my God, I heard your video. How did you pass it?" And they're aligning with my story. It's like, "Oh my God, your story is mine, just a different name and a face." Right. So started doing that. And people are like, "Oh, now that you got your license, what are you doing?" I'm like, "Test prep." They were like, "You went and got your license to test prep?" And I was like, yeah, I want to help those who are struggling, but also providing that platform for all those who need resources like a Rolodex. I'm dating myself, but a Rolodex like at hand. Sure. It's called Everything Social Work Resource Hub. It's on WhatsApp. It's for people mostly in the state of Florida, because it doesn't make sense to have services outside Florida if your client lives in Florida. I'm the administrator. There's about 400 plus people. I'm the one vetting everybody coming in. Right. I'm the one making sure, which is very time consuming, but because I stay up late, there's times that I forget it's 3 a.m. and I'm posting something and people are like, "Do you sleep?" And I was like, "Oh my God, I'm so sorry. I didn't realize the time." But, you know, putting information there about job fairs, resources in the community where they're free, giving the opportunity for social workers who are looking for better resources, or if the information or services they're providing is not adequate, or it has run its course and they need something in a higher level, who can help me? And that chat provides that for them. I also do in-person events, trying to corral social workers, because since COVID, people have been lazy and don't want to come out.
Right.
And I'm a social person. I'm a social worker. I need to be social outside. So I create events. Normally, I start them out by my pool in my house. People are like, "Oh my God, you invite people to your house?" I'm like, "Yeah."
Right. That's what we're in the people business.
I'm in the people business. I do
Right.
people business. I tell people it's like a potluck. Come on, bring something, bring your kids. We're good. And
Right.
then I have an opportunity to do like networking parties where it's just adults, and networking with social workers, but also other professions that we would normally staff a case with. Normally we would sit and say, "Oh, this is what I'm doing for my client. What are you doing?" So we're working smarter, not harder. Like, we're having a social work month series every Wednesday at 8 p.m. talking about the various things social workers do. It's free. Tonight, we're going to be talking about burnout, self-care, because again, we're providing all those services outside. And when we come home, there's nothing to debrief us. There's nothing to help us regulate so that we're able to take off that hat and be present for our families. And knowing that self-care is not being selfish. Knowing that, like the saying is, if your mask is not on, how are you going to help someone else?
Right.
We want to make sure that I'm supplying these events in the community virtually, so that you're more than the social work. You're a mom, you're a dad, you're a spouse to somebody, you're a caregiver for somebody. If you're not okay and your cup is empty, you can't do nothing for no one.
Right.
Making sure that I'm providing those outlets. And then I try, again, all this funding stuff, it's me out of my pocket. So it's not like I have this large wealth of money, praying maybe one day I win the lottery.
Hey, bring some over here.
I have to play the lottery to win, but I sell merchandise. Like the t-shirt I have on says everything social work. I have tote bags and tumblers. So I sell those to recoup the food, the drinks, the raffle items. I try to raffle a lot of things off. People like the little trinkets that you get, but providing that community space, providing that safe space that you can just, let down your hair, so to speak. And we're always looking for partnership or sponsors, because when I have my annual Christmas party, I have sponsors and say, "Hey, I want to sponsor like your photo booth, your DJ, this and that," and I'm always open to that. And I provide a safe space where you can have a good time. In any spaces that I'm creating, it's a safe space to be yourself, because at the end of the day, if we're not filling our cup, we're not ready to help anyone. And that's a disservice to not only ourselves, to the clients that we support.
Absolutely. I think I've spoke about that. I feel like I've talked about that on a lot of podcasts myself, and that's just a big thing with us, working with different agencies or private practices all over the country. And we see that so often with the clinicians embedded within these organizations, is the burnout, is the, how can you take care of others if you can't take care of yourself? You got to find time for yourself to, again, fill your cup, like you keep saying. So I totally agree. And I love what you're doing at Everything Social Work, because you're not only pouring into others, but you're also essentially, like you said, pouring in yourself, right? You're taking care of yourself and showing others that, hey, it's okay to take care of yourself. And it's okay to not pass the first time or the second time. It's okay to be the unicorn, as I believe you'd put it before. So that's okay. And here's the resources that you may need so that you can be effective at doing your job in the way that works best for you.
Exactly.
Love it. So you've shared a lot about what you do and kind of what got you into this journey. So obviously, the exam part was a big turning point, right? What else have you experienced or witnessed in this field that made you want to do things differently or help other clinicians do things differently?
Well, for me, people of color, marginalized people, those areas of community don't have all the resources or the best. There's always a high turnover of clinicians, people leaving, coming back, and families have to start over. They don't have that consistency. When they see me and I tell them I'm a social worker, they were like, "Really?"
Yeah.
"Oh, I've never seen social workers that look like you." And I was like, well,
Surprise, right?
guys, I'm here. Or even sound like me, because again, the stereotypical, it's either white man, someone who's like 100 years old. You always have to see a social worker if something is wrong,
Right.
something that's devastating is never a good thing. Like, oh my God, you're seeing a social worker?
Yeah. So there's
I'm
a
like,
lot of
it
stigma
is
around it.
it is a stigma. And I think also the stigma of the age gap, because normally you see older folks going into this profession and people specific, like you start off learning and going into this profession. I've seen people who are like in their later life, like after retiring from one job, coming into this profession. I've seen older folks. I've seen the youngest, I would say 19, 20 going into this profession.
All across the spectrum.
All across the board, all experiences, and want to give back and want to be placed in a community where they can do the best help.
Right. Love it. And it's seeing all those different walks of life, seeing all these different people coming through and into this industry. What makes your approach unique that is allowing clinicians to help people in a real and lasting way?
I thrive in networking spaces.
Okay.
I have an assignment in my mind. I go, okay, I'm going in here. I need to find someone that does this in specific, like a specific modality, depending on the event I'm attending. If there's people there, because they're going to be talking about this and that. And I'm like, okay, you know what? They're always talking about children in care and the different therapeutic modalities, which are the best for trauma, which are the best that take Medicaid or self-pay. Trying to find out those different resources is important, because not everyone has the greatest medical insurance. Not everybody can pay $100 a session.
Right.
Finding that outliner is important. And I feel like when you do it in person, I leave an impression, because if I email you, you can totally disregard it. But if I meet you and we're talking like this for a bit and I follow up with an email, you're like, oh, I remember her.
Right.
So for me, when I go into rooms, I was teaching some of my in-person test prep. I go and I give eye contact. I have a firm, depending on the handshake that I give, if it's a firm one, I give a firm one back. Right. And I look at you and I say your name multiple times. And then I ask, because normally people yes you to the, oh, have you heard of my company? And people like, yes. I say no, even if I do, because I want you to give me the information so that you know that I'm listening, that I'm interested in what you're giving me, because any relationship is transactional. You're giving to get, as hard it sounds, but that's how we work, transactional. Like, what can you do for me now? What can you do for me later? Vice versa. And I feel that that's important. You're being a social worker. There's a part that says social. You need to be out there.
Right.
That is your job to advocate, to broker, to be a change agent, to counsel people. We're not one facet. We can do individual, we can do like policy, macro work, to going to like our state representatives, and people thrive doing that. That's a different facet of social work. It doesn't only have to be therapy. So bringing that light on to people who are going into school and say, hey, this is not the only thing you can do. You don't have to get your license. But if you do, this is what to look forward to. Let me best prep you.
There's so many things in this industry that, need to change as a whole. And what you're doing, the approach you're taking with folks by engaging with them the way you're engaging with them, those are things I think a lot of people just glaze over and don't really think about. But the way we communicate, it's so important, because it allows it to be a conversation between two people instead of just a one-way sort of conversation, and allows them to share their story and to come out of their shell as well. So it allows you to, like you said, counsel or assist. You're right. Social is part of the word social worker. It's hard to be social worker without the word social, right?
Exactly.
And with that said, if you could see something change in this industry for it to truly improve, what would you want to see change?
Well, my specialty is child welfare. So there's a lot of hiring that goes, but it's not intentional, which is hilarious, I think, because you're talking about you're looking for people to work with families, right? You're looking for people to give tasks to parents to get their children returned. Why would you get somebody that has a degree in something that has nothing to do with social services? So that now you have to teach this person empathy. You need to teach them these things when you can just go to a school of social work, mental health, and these skills, you're learning it for your degree and all you're doing is building on it.
Right.
And I feel like the light bulb has not turned on for a lot of folks.
Right.
And it's like you have to click. I'm like, make it make sense. Why we're working harder when you can just go to that school and all the stuff that you're asking them to do is stuff that they already learned. I go to trainings and I know more than the facilitators. I'm like, how is that possible? You're the first person. And it's like, oh, we're going to talk about motivational interviewing. I'm like, are you serious? And I was like, where did you get your degree? Oh, I'm not a social worker. And I was like, so how you know about this? Oh, someone taught me who taught someone else. And I was like, oh, okay. That makes no sense. But then we don't understand why the reoccurring door is happening, because we're being more reactive than preventive. Putting in the work in the beginning and giving people the opportunity to change. Change takes a long time from some folks. If you are sitting in the same situation and you don't know that that's not the way to do anything until someone says, hey, Dalton, you know what? This is what is going on. And then you're like, oh, okay. Now I'm going to change. But if you don't have that time and you're time restricted because they're like, hey, you have 6 months to get your kid back, but you got to find housing, a job, and detox from drugs. When are they supposed to do all this and visit their children?
Absolutely.
I feel like, people who are making laws, policies are not really the people who are doing the work.
Mm-hmm.
Or you have people who have surpassed and did the work, but they don't have their finger and their pulse on what's happening. And I think a lot of folks in any capacities, when they're trying to do things for the people in the community, is always like, oh, I want it to look like this, but not knowing, is that realistic? Is that, how you measure it? Or is it specific? Making sure that it makes sense. Just because you want this beautiful garden, let's say, in this community, did you even ask them? Is that maybe something that they don't need and need something else?
Yeah, you see that a lot at the top of especially at the top of the food chain when it comes to like whether it's legislature or high level organizations, including insurance companies. Sometimes people writing the policy or the rules don't have that connection with what's happening on the ground, what people actually need. That could be everything from getting coverage, getting services. We work with several clinics that work in the like IOP, like substance use disorder space, right? And and they have families who have lost their kids, who are trying to get their kids back, and they're constantly working at, but they're trying to get sober. They're trying to figure out, housing or sober living arrangement, trying to figure out daycare for the kids because they can't attend programming with the kids with them. So they got to get the kids in a daycare in places sometimes that don't have daycare. So it's all those
like,
challenges.
What came first, the egg or the chicken? It's like, we need this, but we need the other thing.
And we're setting them up for failure.
Yes, exactly. Not only that, realizing that there's so many things at once someone can handle. Mm-hmm. Maybe don't give them all. Maybe, okay, get a job. As long as that under your belt, okay, now you got a job. Now let's think about you're going back into, outpatient or inpatient. What does that look like? If you got a job, how can you do in place? You being a resident or after work, what happens if you work late? How many times is your boss going to say it's okay?
I see people coming like primarily, and just given the last context I gave, like they'll be coming out of an inpatient and the inpatient provides childcare, but then they're going to outpatient that doesn't provide childcare. So now they're leaving a highly structured environment, going to a lower level essentially of care, but now they're stuck with the situation of they don't know what to do with daycare, and they're being put in position for a higher occurrence of relapse, right? They're not balancing out. I get what you're saying there, but I could go down this rabbit hole all day because there's so many things that do need to change, and I appreciate you sharing your perspective there. So, there's a lot of families or a lot of providers out there looking to do work the right way. If they said, I want to be an honest, ethical provider, what would that look like to you? What would be probably one of your number one things to change in the way you handle
I
it?
feel like for someone who wants to be in a profession servicing people out in the community, you have to be intentional and purposeful.
Hmm.
They need to be super ethical because people do things because it's easier, not because it's better.
Right.
And that's a disservice not only to the clients we serve, but to your license, to your ethical, your well house in a sense. But I
Right.
tell people, when you know better, you do better. If you don't know, then ask. And it's okay because you're not supposed to know everything. You're supposed to learn every year. You're supposed to add to your well house, add to your toolbox in a sense. And I think it's important for people to reach out and find out what's the best practice that's coming out, or where's the best place to put your practice or an agency. Because if it's like you're already going into a neighborhood that has 50 of them, just adding one more is not going to do anything. You do a needs assessment as a social worker. They teach you
Right.
that. Going into those environments, if you have a pantry in one corner, you're going to do one in the next corner. Does that make sense?
No, no, it doesn't at all. A lot of people that go into private practice met with the challenges of, hey, this is now a business and you have to be compliant and you have to still provide care. Now they're trying to learn how to be a business owner, and then they're learning how to adhere to, compliance guidelines that are constantly changing,
Yep.
and how to handle insurance, how to handle billing and all that kind of stuff. So they get paid for the work that they're doing while their kids are at home, and they're not spending time with their kids, or they're dealing with trying to get money to pay the rent, right? So now they're putting themselves in such a bad position sometimes, and having resources like Everything Social Work gives them that clarity on what they should be looking for and how to help guide them down these tricky roads. So looking back at your journey so far, what would you say you're most proud of?
The impact.
Mm.
You don't realize the impact until people from your small village, your small community reach out to you and say, thank you for providing this platform on WhatsApp, because I was able to get a job and it's been like 5-6 months and I didn't have a job, and thank you for that. Or having someone who is saying, hey, I needed a resource and I was able to help this family who was unhoused. Or a family that had a child that was having struggles with behaviors, connecting them to resources live and almost on demand kind of services. For me, I think it's the biggest kudos. It's like a pat on the back, because creating this platforms was literally for me, because I felt disconnected from social work. Because when you're in grad school, that's your community. But
Yeah.
when you graduate, if you're not surrounded by social workers, I was the only one in my job. Who was I going to sit and work at a place where we worked with families and I'm the only social worker? So
Yeah.
who am I to sit and vent and get support? So I'm like, hey, maybe I create a WhatsApp, it's free, let's see. And it just started growing from there, and seeing how people appreciate me, not going into this saying that, I want a kudos, I want all that great stuff,
Give me
but
money, right?
yeah, just
Yeah.
all that. And the opportunity that people take time out of the day to give me my flowers.
You're doing great things to create great impact, and seeing that come full circle is rewarding in itself. And we even see it oftentimes with the podcast. It's how can we help each other? How can we just help people? And it's not asking for a dime. It's not asking for people to thank you. You know what I mean? It's simply just being there for each other and creating that community so that people know that there are other people that are like them and appreciate them and support them. And it's a mutual respect sort of thing. So I appreciate everything that you said so far. If someone wanted to connect with Everything Social Work, what would be the best way for them to find them?
So they can reach out to me on social media. I have Instagram, Facebook, LinkedIn, TikTok, or just call me 954-931-0901.
Awesome. You said you have a website too, or are you just using social media?
It's under construction. I started it and it's too techie for me. I'm more of a, in-person social
You're a
person.
people person, right?
I'm a people person. These techie behind the things, that is not for me. When I tell people, when I grow up, I think I'm going to learn some techie stuff, but I have not grown up yet.
Awesome. So it looks like on Instagram, they'd find you at, I think it's everything_social_work. TikTok, it's at everything.socialwork. And then you can probably just search Everything Social Work on Facebook. Veronica, I really appreciate you taking time out of your day to meet with me and share your story so that we can, again, focus on better ways to provide ethical care.
Thank you, Dalton, for the opportunity as well.